Namaste, I am Dr. Sandeep, consultant neonatologist at Rainbow Children's Hospital, Marathahalli, Bangalore. I'm going to talk about developmental supportive care. Preterm babies are those who are born less than 37 weeks of gestation. These are the babies who are supposed to be in the mother's womb, and once they are out of the mother's womb into this world, they are exposed to multitude of sensory stimulation which may be harmful to them. The neonatal intensive care unit, where we care for these extremely low birth weight and these small babies, we need to ensure we try to mimic environment as if it is in the mother's womb, and this is called as a developmental supportive care to ensure these babies' brain grow in a normal way. If you visit our NICU, you will see these babies are cared in what is called as an incubator, which is something like a closed box where the babies are placed into, where the baby's temperature is maintained, and these babies are not exposed to too much of light, and they are actually allowed to grow in a very dark environment. And also the noise levels in the NICUs are very less. People around these babies also talk very softly to ensure that we do not overstimulate their hearing, which could affect their hearing. The baby's positioning is also as if they are in the mother's womb. We do what is called as a nesting, where the babies are put in a position as if they are flexed, where their arms and the legs are flexed, mimicking the mother's womb. We ensure we do not cause any kind of a pain when we are moving the babies or performing any procedure. Adequately sedation is taken care for these babies. And our NICU is a family-centered NICU where the parents are allowed to be with the baby 24/7. The mothers can hold the baby, talk to them, touch to them, so that humane touch is provided to these babies, which is also part of a developmental supportive care. The best way to provide mothers contact and care to the babies is what is called as kangaroo mother care, where the mother performs skin to skin contact to the babies, and during this time she even talks to the baby and interacts to the baby. This is started as soon as the baby is stabilized, which could be in the first week itself, or in a very small baby by second week we ensure to do it. It ensures a proper brain development for these babies, adequate weight gain, as well as prevents infection in these babies. Baby's brain is growing and it keeps growing up to second year of life, and any kind of an untoward events or a stimulation can affect the baby's brain growth. To ensure that the baby grows in a proper way, we provide what is called as a developmental stimulation, adequate stimulation to their vision, their hearing, touch and joint position senses, and this is taught to the parents to ensure that they continue these kind of a stimulation even beyond discharge, which is a part of what we call it as a neonatal follow-up. We do sensitize them that these babies require follow-up even beyond NICU care, and ensure that they are provided adequate information and training to take care of these babies even beyond discharge. Thank you.